ascitic tapping or paracentesis abdominis. Introduce yourselves to the patient and confirm name and age of the patient. Explain the procedure and obtain his consent. Position the patient. Gather the equipment. Pass IV cannulation and start injection Hemasil 500 ml IV stat to maintain the hemostasis. Wash and dry your hands. Put on sterile gloves. Clean the area and allow to dry. At first, urinary bladder should be emptied. The patient lies supine or semi-reclined with a backrest. He or she is reassured and explain the procedure. Under strict aseptic precautions, an IV needle, large bore or 18 gauge cannula is introduced at any one of the sites. Number A. Midway between symphysis pubis and umbilicus, bladder must be evacuated. Or B. Junction of the lateral 1/3 and medial 2/3 of the right or left spino-umbilical line. The needle is connected with a rubber tubing which drains the ascitic fluids slowly into a collecting bag or bottle. In one sitting, usually 1 to 2 liters of the fluid may be drained over 4 to 6 hours. In case of cirrhosis of liver, large volume paracentesis may be done by 3 to 5 liters of fluid aspirated in a single sitting with 6 to 8 gram per liter of salt-free albumin infusion. Diagnostic aspiration requires 20 to 50 ml ascitic fluid approximately. After the paracentesis, the puncture site is sealed with tincture benzoin. Ensure that the patient is comfortable. Thanks to the patient and discard any rubbish. Now, what are the causes of dry tap? Failure to obtain ascitic fluid on attempted aspiration may be due to number 1. Needle blocked by omental patch. Number 2. Perforation of the viscus. Number 3. Presence of very little fluid which could not be targeted blindly. And what are the indications of ascitic tapping? Actually, they are divided into diagnostic and therapeutic indication. As a whole, they are number 1. Diagnostic paracentesis. For example, cirrhosis, tuberculosis or malignant ascites. Number 2. Severe abdominal discomfort or cardiorespiratory embarrassment. Number 3. Refractory to medical therapy. Number 4. Danger of strangulations of umbilical hernia if present. Number 5. Paracentesis may allow better abdominal examination. Needle biopsy of liver, scanning or ultrasonography. 2nd, 3rd, 4th and 5th are therapeutic indications. And now what are the contraindications of ascitic tapping? Number 1. Cirrhosis of liver in hepatic precoma. Number 2. Bleeding diathesis. Number 3. Acute abdomen. Number 4. Pregnancy. And what are the complications of ascitic tapping? Number 1. Sudden cardiorespiratory distress or shock. If appears during the paracentesis, immediately stop the tapping the fluid. Number 2. Introduction of infection, peritonitis. Number 3. Precipitation of hepatic coma. Number 4. Perforation of hollow viscous bladder or bowel. Number 5. Protein depletion. 5 liters of ascitic fluid may contain 50 to 100 gram of protein. Number 6. Constant oozing of fluid, especially intense ascites or malignant ascites. Note: peritoneal biopsy is done with Coop's needle in a suspected case of tuberculosis or malignant ascites or ascites of uncertain origin. Thank you.